Hello, I'm Dr. Omar Bay, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. My favorite topic is called, as usual, is called caring and sharing. And what I mean by that is you go to www.medmoments.com. I look forward to your emails. Thank you for all the emails that have been sent so far. By giving me those emails, we can reach out to others as far as illnesses are concerned and help them take care of their illnesses. This is what it's all about, sharing and caring. We have a great show for you tonight. We have a topic of cardiomyopathy. And we have a physician by the name of Dr. Joseph Campbell. He's a practicing cardiologist to come in and talk to us and give us the A to Z about cardiomyopathy. Dr. Campbell, welcome to our show.
Thank you very much, Dr. B. It's my pleasure to be here.
All right. I'm so glad. You know, Dr. Campbell, he rushed right over he was doing cardiac catheterizations at the hospital and rushed right over to do the show. And I'm so happy that he's taking the time to come on over and talk to us about this very important topic. You know, I'd like to start with my basic question and the one I always start with. Dr. Campbell, what is cardiomyopathy?
Cardiomyopathy is a disease of the heart muscle. There are many definitions. There are definitions by the World Health Organization, and it seems from the literature there are uncertainties about how to really classify cardiomyopathy. But basically, cardiomyopathy can be classified as a primary and a secondary. And each of those categories have a myriad of different diseases that fall under any one of these categories. However, the ones that we tend to see most frequently, at least in my practice, would be the dilated cardiomyopathy. We see hypertrophic cardiomyopathy and the ischemic cardiomyopathy, and just too many to mention this time.
You mentioned some really powerful words there, and I love medical terms. Everybody knows I love medical terms, so we're going to break some of these down. Let's start with the basic word of cardiomyopathy. Cardio means heart, myopathy means muscle, and the thing of it is that the heart muscle gets enlarged. I think that's what we're talking about, right?
Well, in cardiomyopathy, we have the heart muscle that's enlarged, but that's just one type. Mm-hmm. Usually that would be the hypertrophic cardiomyopathy. Okay. Not all cardiomyopathies have an enlarged heart muscle. Oh. There's some cardiomyopathies, especially dilated cardiomyopathy, where the heart chamber is enlarged. If we take a look at this picture here, we're talking about the left ventricular cardiomyopathy. Well, to begin with, the heart has four main chambers. The one that we're concerned mostly about, although they're all very important, would be the left ventricle. And in the hypertrophic cardiomyopathy, the heart muscle becomes very, enlarged. The mass of the heart becomes, really big. And there is a measurement, a standard measurement, which is usually less than 1.1 a millimeter, and when the hypertrophic cardiomyopathy develops, the heart muscle becomes very, very thick.
Alrighty. So there are certain cardiomyopathies that the heart muscle becomes thick. There are others that the chamber becomes too big.
Right.
That's what you're talking about.
That's the dilated cardiomyopathy.
Alrighty. Now, I always think about the heart as a very, very unique muscle. Every muscle in our body gets a chance to rest. It's almost like you're at the beach and you kick back and you're cooling out, and when you go to sleep at night, your muscles are resting, and this is cool, I'm just resting here. But the heart muscle never rests. From the day that you're born to the day of your death, your heart muscle is pumping. That is one very unique muscle. Give me some indication of how it's so different from regular muscles like my leg muscle or something like that.
Well, as you say, Dr. B, the heart is a unique organ. It's one of the most important organs in the body. And without the heart, there's no life. The heart has 4 chambers, as I previously mentioned. And the heart is basically a pump, that pumps blood around the body. The blood comes in, all the blood. Well, there are 2 sets of bloods in the body, oxygenated and deoxygenated blood.
All right, let's step back just for a minute because we're talking about big words here. Oxygenated blood, what does that mean? Does that mean it has some oxygen in it or it doesn't have enough? Tell me what oxygenated.
Well, oxygenated blood has oxygen. That's the bright red blood that we see.
That's the red blood.
The red blood.
Yeah.
That carries all the nutrients, everything for life.
Okay.
Is carried in the oxygenated blood, as opposed to deoxygenated blood. When the blood, circulates from the heart, from the left ventricle, circulates, through this large vessel here, the aorta, it goes around the body. It's bright red oxygenated blood, as opposed to deoxygenated blood, which shows up as sort of blue color here, because the blood circulating through the body, through all the tissues and organs. The oxygen is extracted and carbon dioxide is deposited into the blood. So now it becomes deoxygenated and it goes back into the heart, the right side of the heart. From there, it goes into the pulmonary system to be re-oxygenated. And then the circle of circulation continues lifelong.
Okay, that was a mouthful. let's summarize this just a little bit. So we got the dark blood that oxygen is already taken out of coming back through the veins.
That's correct.
And they come into the right side of the heart, like one of the chambers in the right side of the heart, and then dumps into the second chamber of the right side of the heart, and then from there it's pushed into the lung. And the lung, the oxygen that's where all the oxygen is. And the oxygen gets on the blood and attaches to the blood and the hemoglobin and all that good stuff. And then it goes into the left side of the heart, and the big chamber of the left side of the heart pushes it back out into the body so that the body has fresh oxygen aided or blood with a lot of oxygen in it so that each cell of the body can use that oxygen.
That's correct.
Do I kind of have it right there?
Yeah, that's correct.
All right, good. So tell me, as far as cardiomyopathy, is there a certain age that the heart actually starts not working well for us, or can it happen at any age?
It can happen at any age. For instance, with hypertrophic cardiomyopathy, sometimes that develops at a very young age, and it progresses as one becomes older.
Okay.
Also, I've seen a lot of dilated cardiomyopathy in young people, very, very young people, teenagers, young patients in their 20s, 30s, as opposed, you might expect to see these things and disease in elderly patients, but any age is.
It can occur.
It can occur.
Okay, all righty. Now, what are some of the symptoms that come along with these type of problems with the heart? Now, I know just to reiterate, the hypertrophic is the one that the muscle is really thick and the heart just can't pump as efficiently as it should. The other one, it's dilated cardiomyopathy, is when the chambers of the heart are large, so it just can't pump the blood through as efficiently as it should, and the heart's just not circulating the blood well. So what are some of the symptoms that you have because this is occurring with the heart?
Well, one of the some of the common presenting symptoms of cardiomyopathy, most notably dilated cardiomyopathy, would be shortness of breath. The patient all of a sudden develops, shortness of breath, climbing steps or doing irregular activity. They may develop swelling in the legs become swollen. Some patients may present with arrhythmias where the heart begins to race uncontrollably.
Now, arrhythmia is when that's an abnormal heartbeat? That's what you're talking about?
Abnormal heart rhythm. The heart begins to race abnormally.
Okay.
Some patients also present with sudden cardiac death. That might be the first presentation.
You mean you just die?
They just die.
Oh my goodness. All righty. All right. So what we're talking about is a really serious problem that can occur to someone's heart.
That's correct.
All righty. Now, is there a particular gender? Does it happen more in males or females for this particular disease?
Well, from my experience, I see there's a preponderance of male, but I see male and female quite frequently in my practice.
Mm-hmm. Okay, all right then. What causes this? I mean, is there something that I can stay away from so I make sure it doesn't happen to me?
Well, as we mentioned initially, there are so many causes, for cardiomyopathy. There's ischemic cardiomyopathy. That is where ischemia is a deficiency of oxygen, deficiency of blood getting to the heart muscle because of a blockage in the blood vessel. Mm-hmm. And ultimately, your heart muscle becomes deficient, and it functions malfunctioning, and that would cause the heart to become dilated. There is a change in the geometry of the heart. So the weak muscles, becomes dilated, and also because the heart is weak, it's not able to pump the blood effectively out of the heart. So now you have a larger volume in the heart, and that stretches the heart muscle, and it's like a snowball. Mm-hmm. So the weaker the heart, the more blood stays in the heart. The weaker the heart, the more blood stays, and eventually the heart muscle becomes very thin. Mm-hmm. And the chamber of the heart becomes very dilated. Mm-hmm. Right. And it's not able to get the blood effectively around the heart. Now when that happens, we see fluid accumulating in the lungs or in the dependent positions in the legs, mm-hmm. or in the lungs, and you become very short of breath.
Mm-hmm. Mm-hmm. So what you're talking about is the blood has to go through each chamber and go through the lungs. While it's going through each chamber, everything has to keep going. It's like a traffic jam. Right. If it kind of backs up, then if it backs up at the tunnel and then it backs up on the highway, then the next highway is going to back up. So that's what happens. So if the left side of the heart backs up, then the lungs are going to get nice and soggy and filled up with fluid because the blood is not going through the heart properly, and it's not going through the lungs properly. Yes. And then the legs get swelled up because it's not coming up to the heart properly. That makes sense. That really makes sense. Are there other causes of cardiomyopathy, like viruses, or can I eat too much and cause it, or Can I be running too much or exercise too much and get it? I'm really concerned about this because I just want to know more about it, how I can prevent it.
Well, for instance, the dilated cardiomyopathy, as I mentioned, can be caused by ischemia, lack of blood. That can also be caused by various viruses, various infections, can cause that. Genetics can cause cardiomyopathy. Basically, those mm-hmm. are some of the common causes. Now, when you say
genetics, what you're talking about is if my dad had it, then it's a chance that I may get it?
That's correct.
Okay, all righty. It's interesting because now, if someone was coming to your office, let's just put it this way, how would they present? What was the most common presentation of somebody walking into your office and having a cardiomyopathy? Do they know that something's wrong with their heart or somebody? How do they usually present when they come into your office?
Well, the common presentation would be shortness of breath and leg swelling.
Okay.
And from that, we do various tests that would allow us to make that diagnosis.
Okay. So what are some of the tests that you may think about doing when this patient presents to you?
Well, we begin, of course, the history. We get a history from the patient. History is very important because, as we just mentioned, some of these cardiomyopathies, they're genetic, they're run in the family. Mm-hmm. So you might find that if a family member has that disease, then there is a probability that other members of the family may have that disease. Right. So that history. Then we do an EKG or ECG. Mm-hmm. We look at the configuration of the ECG, and that will tell us there are certain patterns that are peculiar to certain cardiomyopathy, especially hypertrophic cardiomyopathy. That once you see that EKG, you immediately know that that's a cardiomyopathy.
Oh, there's a pattern.
There's a pattern on the EKG when we the EKG tracing.
Tracing, yeah.
Also, one of the common and most important tests that we do would be the echocardiogram.
Oh, all right.
The echocardiogram is an ultrasound of the heart that gives us information about the size of the heart. We also we look at the chamber size of the heart. It gives us information about the thickness of the heart muscle, the chamber size, and it gives us information about the flow of blood and the valve. Also, valvular heart disease is another common cause for cardiomyopathy. And all that information can be obtained by echocardiogram testing.
Okay, all righty. Now, I understand that there's certain heart disease that may be more common in blacks than whites. Is this something that you see as well with this particular disease?
Well, to tell you the truth, Dr. B, it seems that most diseases are more common in blacks than in whites. Right. But cardiomyopathy definitely is one of those.
Now, the thing of it is that I know that there are certain diseases like that are common. You're talking about different races, like sickle cell anemia that may have, or a thyroid disease that may have blood that goes around very quickly throughout the throughout the body. And will these kind of injure the heart because it demands the blood going around so quickly and stuff like that?
Actually, one of the causes of cardiomyopathy also is arrhythmia.
Really, that means abnormal
heart rhythms. Yeah, that like for instance, atrial fibrillation, which is a very common heart rhythm abnormality, can cause cardiomyopathy.
All right.
Also, alcohol. Excessive alcohol, consumption can cause alcoholic cardiomyopathy.
Oh, all righty. So what you're saying is that if those people that overdrink, then they can have that could truly hurt their heart.
That's correct.
All righty. Now, I know you were talking about the specific aspects of the heart where the heart vessels, the vessels of the heart would get clogged. Now, or there buildup of like cholesterol or different factors in the blood vessels where the blood flow decreases and the muscle of the heart is not getting enough oxygen, and that would be a reason for the heart not working appropriately. Can that lead to heart attacks as well?
You mean you're talking in reference to the blockages in the blood vessels?
Yeah, of the heart itself.
Yeah, that's correct. That's one of the most common causes of heart attacks.
Okay, now a heart attack, what we're talking about is an area of the heart that actually is when you said ischemia, I'm getting back to ischemia to understand how this works. The blood flow to that area of the heart that blood vessel feeds does not get enough oxygen, so that's ischemia. So if it closes off completely, does that part of the heart die, or what happens?
If it closes off for sufficiently long time, then it will die. That part of the heart muscle will die. I mean, the blood supply to the heart, if we look right here, there are three main blood vessels that supply the heart. This is the blood vessel on the right side of the heart, and that breaks up into different branches. This is the main blood vessel. It's called the left main, and if there is a blockage sufficiently significant in this vessel, you can die suddenly, because that means that you'll not be getting enough blood to this whole area of the heart here. Now, if we look at these dots right here, if there's a blockage in this area right here, that means that you'll not be able to get sufficient blood beyond the blockage. And that part of the heart muscle becomes deficient, is starved more or less, and it shows up as maybe chest pain, shortness of breath, dizziness, burning sensation in the chest, etc. Number of symptoms can arise, and of course, if it's not taken care of quickly enough, then a part of the heart muscle will die, and then eventually there is what we call remodeling, or a change in the geometry or configuration of the heart. Ultimately, part of the heart becomes weak, and ultimately that can lead to cardiomyopathy also.
All right. Now, once you have cardiomyopathy, and I know there are different types, can you get rid of it? Can I do something? Can I go out jogging every morning and start lifting my weights and saying I'm going to get rid of this cardiomyopathy?
Not usually. There are some cardiomyopathies that are corrected, that can be corrected. Of course, alcoholic is one. Okay. There are so much, viral diseases. Once they're cured, you can have a reverse in that. But mainly, when you have a dilated cardiomyopathy, and especially hypertrophic cardiomyopathy, they're not correctable.
Okay. Yeah, they're not correctable.
No.
All right then. All right. Now the thing of it is that what about as far as certain types of I understand that there are signs of cardiomyopathy, like you said, the swelling, and I know something called congestive heart failure, and that's secondary to the fact that the heart's not beating appropriately. Can you describe what congestive heart failure, because that's thrown around if you come to the emergency room and you have shortness of breath and they'll say, oh, you got congestive heart failure. What does that mean? What's going on?
Well, congestive heart failure is basically an inability of the heart to effectively pump blood around the body. And so we get congestion. We mentioned before that the lungs become congested if the heart is not able to keep that circulation going fast enough. You have fluid that gets deposited in a dependent area, and of course the lungs is one of the most dependent area, and a lot of fluid gets accumulated in there, and you become congested, okay. Short of breath. However, we can also get congestive heart failure from not a weak heart, but from a strong heart, and we see that most often in hypertensive patients, particularly elderly patients, where the heart is very strong contraction. So it's able to get the blood around, but the pressures inside the heart become so high that the heart has to work so hard to get that blood around. It has to generate a pressure high enough to push the blood forward, and ultimately that causes heart failure also.
Okay.
So you have a weak heart on the one hand from a dilated cardiomyopathy, on the other hand you may have a very strong heart, robust heart with excessively high pressure, and you can get congestion from that also.
Okay. Now we're talking about this. Most of the problems that we're talking about at this particular point, we're talking about the left side of the heart, and that part of the heart that pushes the blood out into the body. And when that part gets weak, what happens is the blood kind of backs up into the lungs and into the, into the system. What about the right side of the heart? What about that part of the heart that is on the right side that may not be the strong, big part of the muscle? Does that get big too? Does that have a change in cardiomyopathy as well?
Yes, indeed. The right side of the heart can become dilated and big and weak also. Now some patients may have just right heart failure, or just the right side of the heart is big, dilated, and weak. In those cases, you have fluid accumulating mainly in the extremities. If it's bad enough, if it's significant enough, you can have fluid accumulating in the breast, in the female, all the right side. That happens often with patients that have leaky valves on the right side of the heart.
Right.
There's this valve right over here, which is called the tricuspid valve. If it's leaking very badly, then fluid accumulates in the right ventricle right here and the right atrium, and so that right pump, which is necessary to pump blood into the lungs, becomes ineffective. And you have fluid accumulating there, and the big difference though is that usually right heart failure, you don't get those symptoms that you get in the left heart failure, where you have the fluid accumulating in the lungs and causing shortness of breath and things. So it's mainly, if you want to see a cosmetic issue. Fluid in the legs and the breast and the abdomen, the stomach.
Okay. And I know that there are certain meds that we give to try to get rid of this fluid to stabilize the heart as well. And, so that we can get that fluid off so the heart can work at least a little more efficient. Mm-hmm.
Yeah, that's correct. Mm-hmm. Well, after we've diagnosed cardiomyopathy, there are certain, routine treatments. Mm-hmm. One, it depends also on the contractile strength of the heart.
Right.
We estimate the strength of the heart, from, up to 50 to 55%. That's considered to be normal.
Right.
Anything lower than that, the lower you go, the weaker the heart is.
Okay.
And the higher the risk for getting congestive heart failure, and the associated symptoms.
Right. All righty. Well, the thing of it is that I'm just so glad we're going to have to, our time is running out and we're going to have to wrap it up here. But, I'm just so happy that you could take time from your busy schedule to come in and, give us an understanding of what cardiomyopathy is about, the different types of cardiomyopathy, and actually how the blood goes through the heart and what it does for us and how it gets out into the body and is oxygenated and what it does for us is so very, very important. All right. Thank you very much, Dr. Campbell, for coming on the show.
Thank you very much, Dr. B. It's my pleasure.
Yes. All righty. Well, in closing, as usual, remember, as far as sharing and caring is concerned, share those med moments, and I appreciate you emailing me and letting me know what's going on out there. Remember, www.medmoments.com. Email me some more because I just love reading them and it lets me know exactly what you want me to put on the show. I appreciate it. Never institute any change in your medical care until you consult your physician. I trust each and every one of you continued good health. I am Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. Very good show, Joe. Very good.
Thank you.
Excellent, man. We rocked and rolled.
Yeah, it's such a big...